Dr. Crockett and Dr. Sanders here with Zeal Integrated Health, and today we're going to talk about four main types of headaches. There's really several categories of headaches. There's, I think, 129 different types of headaches that you can be diagnosed with. But I really want to talk about the four main types. Tension is going to be one of the most common headaches that people suffer from. Migraines, cluster headaches, and then one of them that most people don't really think about is medication overuse. So Dr. Sanders, kind of talk a little bit about tension headaches and what that involves.
So tension headaches is one of our primary kind of headaches. It begins with tension of the muscles of the head, but more importantly and most commonly seen is tension in the neck. The tension of those joints and the neck muscles tend to pull a lot on the back of the head. Most people who experience those tension type headaches feel them in the back of their head pulling around to the front.
Yeah, so these things, we're seeing those really, they're more common now than I think in the past, just with everything going on, people working from home, they're sitting in maybe a chair at home that maybe isn't designed to be working out of every day. So just because of their posture, you're seeing a lot more of these cases come into the office. Now, one of the things that we see from a migraine standpoint, these are usually vascular driven. It's the second most common type, but we see that a lot of these people that struggle, I'd say, there's probably 30% of these headaches out there that are migraines. And there's probably about a 5% of those people suffering from those that are dealing with 15 or more headaches a month. I mean, this is half the month they're dealing with a headache. It's just crazy that they struggle with this. And a lot of these, when you think about vascular, you're thinking, well, there's not much we can do about it. But a lot of times, hormone balance can have an influence on this, blood sugar levels, the amount of inflammation in your system. So the diet can have a huge influence on this, and just some neurological aspects that influence the vessels and what they're doing. One of the things that we'll run in the office is just a simple blood test called homocysteine. And when that value goes up, these vessels tend to constrict down, and it really drives migraines. So we can test some things that some doctors maybe aren't checking if you're dealing with migraines. The other aspect is medication overuse. We see these, and a lot of times we call them rebound headaches, because people are taking a pill, they're taking a pill for their headache. It helps their headache maybe for a temporary amount of time, but what happens is then that wears off and here comes the headache again. So what do? They reach for that bottle of pills, and it can be over-the-counter medicines, Tylenol and ibuprofen, but we see prescriptions being done the same way. But it can also be things like caffeine. Some people, they're addicted to the caffeine and it's driving their headaches. If they don't have that full pot of coffee every day, here comes the headache. And so a lot of times we need to work on pulling those things out. I'm not telling anybody to stop your medication right now. Obviously, that's not the approach on this. You want to do this gradually, and you want to work with your primary care physician or somebody like ourselves to work through that process. The last type of headache is the cluster headaches. Talk about that.
The cluster headache is very rare. Less than 1% of people experience them. However, they are by far the worst. It is strictly a neurological headache. And those feel like people, and I mean this in all sincerity, but they feel like they want to die. It's just a terrible headache that repeats itself. Boom, boom, boom. And these ones are ones where you really want to be in touch with a primary care physician or someone like ourselves to handle them.
Really immense pain with those. Immense. Yeah, definitely. So let's talk a little bit about just the triggers that cause headaches. Talk to me about some of those.
So like we were saying with tension headaches, any muscle tension, and all the way to the shoulders, to the upper back, all of that plays a huge role on your headaches. Another thing is stress at work, stress at home, school, stress with anything going on will cause that muscle tension, as well as increased blood pressure and things like that that bring on those more vascular type headaches.
You bet. Just a lot of people are doing school virtually now. Just think about the stress of having to run a classroom in your house, right? So, we're talking about stress, the anxiety that's going on. We see foods trigger things. Somebody eats cheese, maybe wines. Mm-hmm. You think about things like that can trigger it. We talked about the caffeine earlier, can be a factor on it.
And the caffeine in some medicines, even like Excedrin or any menstrual medicines that have that caffeine in them, can cause a vasoconstriction.
You bet. So just triggering the body's, just pushing the system with these things. Now, there's also a few things that we don't think about. Blood sugar. Somebody skips a meal, you might get a headache from that.
Absolutely.
So blood sugar drops too low, a headache might occur. And then we talked about earlier, posture can be another huge trigger. So
Very
just
huge.
making sure that you may not be working in your typical desk chair right now, making sure that you got good posture, you're not slumped over a computer somewhere as you're doing that. So I hope this gives you some information about headaches, and more importantly, some triggers to look for and check. And if you're struggling with headaches, check out our website and check out maybe calling the office to see if we can maybe help with that process. Have a great day, and remember, there's a healthy person inside each of us.